Hi, my name is Dr. Matt Comfort. I practice in Roseville, California. And today I have my wonderful, fantastic assistant, Lacey Greenacre. Today we're going to demonstrate taking photographs using the chair-to-chair technique for the American Academy of Cosmetic Dentistry photograph requirements. It's something that I've come across that assists all doctors in taking the photographs. One of the largest problems that we have in taking the requirements for our accreditation as well as our just routine cosmetic procedures is really the angulation of this camera. The camera, as you go through some of the programs, assessments of other cases, you will see different angles. And doctors have repeatedly said it's difficult for them to really get some sort of stability or achieve stability with their camera in terms of both the plane of which they actually take the photograph and the distance and the focusing, and utilizing the assistant stool for the doctor as a tripod essentially eliminates a stability problem for the practitioners. So what Lacey and I are going to demonstrate to you now is a simple way of taking photographs, the 12 views that are required by the American Academy of Cosmetic Dentistry for accreditation purposes. If you'll notice here, this is the assistant stool, and the assistant stool is a perfect balance. It has a very rigid arm, and as long as you're over the post here, this will support a lot of weight, and a lot of movement will be eliminated if the doctor taking the photographs place a lot of weight on it. So we're going to demonstrate now. We're going to start off with the full face shot. So that is the U1 setting and the infinity on the manual mode of your camera. And Lacey, we're just going to have you smile for us real quick. So what I do here is I essentially put this post really directly below my left elbow. I flatten out my left hand and I place the camera on here, and I try not to touch the manual setting of the lens until I get her in focus, that is. So here she is in focus now, and I'm going to go ahead and take that. So that would be our very first photograph. The second is now a closer photograph, a series that's on the U2 setting, and we're going to go with the 1:3. The 1:3 requires us to be a little bit closer to Lacey, and if you notice right now, there's really two variables. If you take a look at the plane of the camera's lens, it's really pointed at her eyes, so we're a little too high on this. You can do one of two things. You can either have the patient raise her chair up, or something that's a little bit more simple than that, is that you can, underneath the chair, you can grab the chair toggle, and you can actually just pull up, and that will go ahead and lower the plane of the camera via the chair. So if you want to pan back for a second, you will see I'll pull up and the chair will go down, and now this is almost in line, so maybe just one more tap down ought to do it, and that's where I'm at. You can now see that really from the middle of my ring flash is pointed directly at the patient's smile. So we're 1:3. The nice thing about this is that as we come in on the patient, I'm putting all of my body weight, upper body weight, on my left elbow, and I'm not touching the lens at all for focusing. I'm actually moving my body to over dramatize it. I'm moving my body like this towards the patient. So right in this frame right here, I see that the teeth, or the glare off the teeth, is actually in focus, and that's where I want to go ahead and take the picture right about here. What's nice about this position is now I'm able to swing around to the patient's left while instructing the patient to pull a little bit more with the left. And now I am taking the photograph right off the patient's lateral incisor, which is another American Academy of Cosmetic Dentistry required view. I'm able to do this. Now what I'm going to do is that I'm going to maintain this arc of photography, and I'm going to swing over to the patient's right. They say, I'll have you pull a little bit more with the left. And best bite that normal, there we go. Now I can, while resting all my weight on my left elbow, I'm able to keep my camera from over or under angulating on a vertical axis or from side to side. I effectively have a built-in tripod with the assistant stool. The next set of views requires us to go closer to a 1 to 1.5 ratio, which means I'm going to be very close to our subject. As I zoom in on her, this is where a lot of doctors feel that they're unable to control the focusing because of the movement and a lack of bracing. So again, I can, without rolling over the patient's feet, I can actually come closer to the patient. I can come in and out just ever so slightly. A slight movement of the camera will actually cause the patient's depth of field to become unfocused. So at this time, I come right back to right about here, and I'm able to take a photograph. And that photograph frames the back distal aspects of the canines, which is a requirement by the American Academy of Cosmetic Dentistry. There is also a blackout contrast, which is a device to block out the back of the teeth, will be demonstrated here in our next set of the film. This is called the contraster. The contraster is part of the PhotoMed kit. It allows the subject's teeth to be highlighted on a 1 to 1.5 ratio for the DSLR. The way I take this is I place this end into the patient's mouth, and I'm able to place the bottom of my ring flash on top of the contraster. This also allows for slight variation in terms of the stability factor when the patient closes down. Lacey, just close down just a little bit more, right like that. So I'm actually able to, with my hand, I'm actually able to brace it against the ring flash and the contraster, and I'm able to move in ever so slightly, and from there it brings additional stability to my camera. From there, as I move over to the patient's left, I'm actually able to keep the patient straight. I'm actually able to move the contraster over to this side, and I'm still able to achieve a contrast on the patient, as well as maintaining stability with the left hand stabilizing the contraster and touching the ring flash on a 1 to 1.5. So I hope this helps you. I have developed this technique, and I hope that it brings you much peace in taking the requirements for the American Academy of Cosmetic Dentistry photograph series. Thank you. Thank you, Lacey.
Of course.
So what I'm doing now is I've got my hand around my assistant, and I'm locking my right arm against my body, and I'm slowly moving forward. Stop laughing, assistant. Thank you. And I'm moving forward, and I'm able to stabilize both the camera and my body, having my body around my assistant, assuring my assistant that I'm not trying to hit on her.
Oh my God.
For the mandibular occlusal,
Open nice and wide.
first apologize to the patient for getting too close to the patient's body. Gently lean over and pull these lip retractors down.
Colder.
Rest on the armrest. Pull your right elbow in and tuck it underneath your body, and progress slowly towards the patient, until it becomes in focus, and then take the photograph. If your assistant isn't available because she's eating in the staff lounge, turn on a fan behind you to keep the mirror from fogging up. Did you guys get that?
Keep the fog from rolling in.
Place the mirror in such like this. Open, please. And then what you do, it is important to flex the muscles, pull your elbows in, and gradually decrease the distance, and then until you become in focus, and then you can take a photograph. That's for the occlusal shot of the maxilla.